and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, everybody. I'm Greg Keeley. Welcome back to another You and Your Doctor program sponsored by All County Healthcare. Always here for your home care needs. We're Medicare certified, serving Miami-Dade, Broward, and Palm Beach counties for now more than 20 years. Rated 4.5 by Medicare.gov. Find us at allcountyhealthcare.com. Well, tonight our guest is Dr. Timothy O'Connor, a neurosurgeon who practices in Boca Raton. Doctor, we appreciate your being on the program and taking time out of your busy schedule to be here tonight.
Thanks for the invitation, Greg. It's great to be here.
It's our pleasure, sir. And we're fortunate to have the good doctor still in Florida with us as a native of Coral Springs. He received his medical degree from the University of Florida, graduating with honors in research and academic excellence. So congratulations on that. And then it was quite a cool change for you as you went well up north to continue your training. Could you elaborate on that some for us?
Yeah, I'd be happy to. It was definitely a little different than here. So I grew up in the area back when the world was lit by fire here in Coral Springs, and the area was a little bit different back then. And went up to Gainesville to train college and med school. Started my training in Gainesville, and then ended up doing a complex spine fellowship up in Buffalo and finishing my training there.
Wow, that's fantastic. And so during our pre-interview, you mentioned that your grandfather had to deal with Parkinson's, and that was an impetus for you making neurosurgery as your chosen profession. Could you please share with us how that shaped your life as a doctor?
Yeah, of course. So I was always interested in the brain being the most complex system, that we know of. And, it was really a turning point when back in college I was able to see a surgery where a surgeon went in with an electrode and inserted it into a patient with Parkinson's. And just to see the instant switch where all of a sudden the patient's tremor just was completely resolved, that was really a turning point for me. And thinking, wow, like we can actually go in there and fix something like that.
That is amazing. And then to see how that was applied to him, that had to have been really meaningful for you.
It was.
Mm-hmm. And you say you've always been fascinated by human brain function, and that really prompted you to start such a meaningful career.
Yeah, my background was in neuroscience, neurobiological sciences, and that's initially what led me down this path. I started getting interested in neurosurgery research, and one thing led to the next, and before I knew it, I was, in the OR and operating on brains.
So you definitely found a purpose. That's fantastic.
I did, yeah.
Mm-hmm. And so during our prior discussions, you mentioned how critical computer navigation is when doing a minimally invasive procedure. Now, earlier today, I had a chance to speak with a very grateful patient who essentially was not able to have any kind of quality lifestyle at all because of debilitating pain in his back, and essentially was rendered disabled by the disc issue that was rubbing up against his sciatic nerve. Now, we read about these therapies on websites and brochures and about what a difference it can make, but this gentleman said today that for about 3 months he couldn't even move and couldn't even really sit in a chair. Yet after a consult with you and a minimally invasive procedure, he was back on his feet almost immediately and now is extremely grateful to get his life back. Could you take us through that whole process, what this gentleman had to have been dealing with moving forward, and how you use that technology and expertise to essentially help him to get back on his feet again?
Yeah, it's an honor and a privilege to take care of these patients every day. And it's been a changing landscape. There's a lot more technology in the OR now. There's, an ability to use advanced techniques for a minimally invasive procedure that even just a few years ago, patients would have needed a much larger, and bigger recovery for. And so what I'm able to do now is go in there with the MIS, minimally invasive type of procedure, and go and use a small dynamic retractor and able to take the pressure off the nerves that are causing the back pain, causing the pain shooting down the legs or neck pain. And so, it's an honor and a privilege really to take care of them.
Well, we appreciate your attitude towards that because, many of us have suffered with sciatica before, and they know what a helpless feeling that can be when you just can't get any relief. And basically, it means that you can't really even move at all. And so just speaking with this man today indicated to me that your job as a therapist was held a real significant part of his life. And I can tell you for sure that he's grateful, and I would suspect he probably communicated that with you as well. So.
Yeah.
And so your approach to patient care is to focus on each individual and provide care that reflects the patient's own individual goals and personal goals. That is somewhat different at times. You never really know what you're going to get when you have a patient. Talk about how you decide, what a patient needs as per what their goals are, and how you can really differentiate that when affording your treatment options for them.
Yeah, so I always try to max out any type of conservative treatment before even discussing surgical options. So if patients have pain in their back, shooting down their legs, generally I start with physical therapy, some type of chiropractic or massage manipulation. Oftentimes, though, if that doesn't work, what we can do is we can do a minimally invasive type of procedure. If they have underlying instability, I can use robotic assistance and computer guidance to, with a small incision, help stabilize their back or take the pressure off the nerve that's causing pain shooting down their legs. And the same thing for any type of neck pain shooting down the arm, able to use a small incision in the crease of their neck to take the pressure off the nerve, off the spinal cord, and then stabilize that area. And so, there's a lot of technology now that we can use in the OR really to the benefit of patients.
Mm-hmm. And so you learned all about that up in Buffalo then, huh? That's amazing.
Yeah,
and
yeah.
It's really outstanding that you would make that commitment to travel all the way up there and then to come back down and continue your practice and begin your practice down here.
Yeah, it's really been great coming down to the town I grew up in to help patients around here.
Yeah, I bet everybody was excited to see you come back because they realized what a big contribution you're going to make for the community at large here. And so you've seen some really miraculous things through what the imagery and the technology can do for patients. And this has really prompted you to develop what you hope is really a state-of-the-art program for your facility to become a national leader in South Florida. What are some of the things happening that are really helping your program to grow right now?
Yeah, it's a really exciting time. The Marcus Neuroscience Institute, which is the institute I'm part of, is really a neurological nexus of kind of a center of excellence of care. And we're able to have, the support of incredible partners that I have and the foundation, the administration, and really have the resources to build the next level of care. And so we're integrating robotic technology into the OR, computer navigation into the OR, and allowing us to do things that has never been done before.
So the old Ben Franklin adage, an ounce of prevention is worth a pound of cure, and the correct diagnosis is the most important thing, right?
Yeah, exactly.
Mm-hmm. And so is there a typical patient that you treat? If it would seem like there might be a wide variety of patients whom you serve. Could you talk about that whole continuum of different patients whom you might serve?
Yeah, there really is. Neurosurgery really encompasses anything, any neurologic disorder within the brain, the spinal cord, or the spine. And so my specialty is in spine. I'm the director of minimally invasive and robotic spine surgery at the Institute. But I also operate on the brain and treat brain tumors as well, any types of blood clots in the head. But primarily, my focus is on spine. And so any type of pain within the neck that's radiating down the arms could be caused by a herniated disc. Any type of back pain, especially when patients walk, it could be caused by any underlying instability that we can treat with helping to strengthen that area of the spine. And any type of pain that are shooting down the legs could be caused by a herniated disc, and that was the story that you had mentioned. And so I'm able to go in with a very small incision and help relieve that pain and get them back up, back to their life.
That is amazing. And so you have a referral process certainly for patients. How does that work out for you? What are the steps for that?
So any patient, if they're interested or would like to see me, is welcome to call and schedule an appointment. Mm-hmm. The number is 561-955-4600, and I have an office in both Boca and Boynton Beach. Mm-hmm. The direct email as well is spineclinic@baptisthealth.net.
Mm-hmm. Wow, okay. And so the other things that are at issue, of course, in this day and age, COVID. How has COVID impacted your practice as you've attempted to navigate your way through this?
Yeah, it's definitely a dynamic type of landscape now. Just a few years back, before the vaccine, patients were coming in with all sorts of complications of COVID. And I remember doing multiple surgeries before any of us were vaccinated and, doing whatever we could to help these patients. Now, during that time, a lot of the elective surgeries, a lot of the elective cases were postponed because we wanted to preserve those hospital resources. Now, as things are starting to get back on track, we're starting to do more elective cases. And so at least in our institute, at our hospitals, we've resumed back all elective cases.
That's really good to hear. And so with these sciatica issues and these lower back issues, do you tell your patients to some certain stretches that they should do or are predominantly very effective in dealing with a lot of these types of issues?
Yeah, that's a great question. So there's a lot of different conservative treatment modalities that they can use. It really depends on the underlying pathology. And so we work with physical therapists, interventional pain management, mm-hmm. and a host of other treatment modalities to really tailor it to that individual.
Mm-hmm. And so what do you feel like your next steps are for the program that you're getting in place? Are you recruiting more physicians, or what exactly are you doing to bolster that even further?
Right, yeah. So right now we're getting even more technology in the OR. So we're getting new cutting edge equipment integrated into the operating room, new CT navigation, new robotics. And it's a really exciting time, especially kind of seeing what's coming down and helping to develop some of that technology. Before long, we're going to see augmented reality, virtual reality being integrated into these systems. And so we'll be able to see the anatomy of the patient before we ever step into the operating room. Even now, with the equipment that we have, using the robotic platform, I can plan out the surgery virtually before the patient even gets into the room. And so I'm able to show the patients what we're going to be doing, able to plan everything out beforehand, and able to do things with increased amount of precision that just a few years ago wasn't even possible.
And who has developed all this technology? That's so fantastic. Is the Neuro Society, or is it just the American Hospital Association?
Yeah.
Or what is it? What's going on here that all this information is coming out and you're able to utilize it?
Yeah, there's a lot of different pathways for integrating technology into the OR. And all of the above, essentially. There's private companies, there's from a foundation standpoint, from the American Academy of Neurological Surgeons. All of us are working towards helping to integrate and build new technology into the OR to help our patients.
That's really outstanding. And so what do you think is going to be happening in the next 5 years for all these things that seem to be coming into play?
Yeah, even now we're integrating in artificial intelligence, we're integrating in more data to be able to say, with a patient that presents with this type of pathology, this type of spine, this exact degree of lordosis that they have, what's the precise interbody, what's the precise surgery that we should do to help that patient, and then using data from thousands of other patients, be able to say, hey, we know with certainty, and we know with a high degree of certainty that this is the right procedure for you. And before, there was a clinical gestalt that we had that we evolved over our practice, but now really getting high quality data and integrating that into our planning software systems, integrating that into the operating room, I think that's kind of the next phase of what we'll see transpire.
That's really incredible. And so the last few years, and for laymen like me who walk into the Barnes and Noble and all of a sudden they see all these brain books and all these neurological books that people can read, and it didn't seem like that really happened until like the last maybe 5 or 10 years or so. Can you speak to that, and how beneficial is that for people to be able to benefit from that?
I think that we've learned a lot about the brain over the last 5-10 years, especially with new types of imaging modalities, functional MRIs, the new science that's coming out. I think that as we know more about it, I think that the fascination with that is really expanding. And so it's becoming more accessible to people. It's becoming this incredible complex structure we're finally starting to understand. And so I think that's what's driving all this, and what's driving people's curiosity to that as well.
Isn't that interesting? Well, thanks so much for your input so far, and we will be back right after this.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to You and Your Doctor, sponsored by All County Healthcare, a Medicare certified company. We work with patients in Palm Beach County, Broward County, and Miami-Dade for more than 20 years now, led by owners Lou Biazzi and Delroy Clark and their dedicated team. We're located at 4850 North State Road 7, Suite G103 in Lauderdale Lakes. Our main phone number is 954-717-7027. And we are back again with Dr. Timothy O'Connor, and we want to make sure that we share this gentleman's place of practice in Boca Raton, located at 800 Meadows Road, and the number that you may call to schedule an appointment is 561-955-4600. And so, Doctor, the brain business and kind of this whole inflation of brain information the last 5 or 10 years, were there certain books or certain things that you learned through those books, or was it all through professors' lectures and texts, or what were those?
Yeah, my experience is a little bit more hands-on, and so certainly I think my experience has come from operating, being in the OR and helping to, help these patients with various pathologies, whether it be a brain tumor or any type of pressure on the brain that we have to relieve. I think that the great thing about the Neurosurgical Society is that we go out and we publish peer-reviewed papers and present at these national academies, and it's amazing what people have found, I think, over the last 10 years, including surgical techniques that we're able to perform minimal invasive surgeries for brain tumors as well. We're able to use endoscopic procedures to help remove tumors and really integrate computer navigation into the OR with that field as well.
Mm-hmm. Well, how much of an eye-opener was it when you really started getting into the computer navigation?
Yeah, it's a whole nother experience really to look at something, but then to also get the X-ray vision and integrate that into the practice. And so what we're able to do is we're able to, when a patient gets into the OR, we're able to take a scan that they had before or take a scan in the operating room and then merge that with their anatomy. And what that lets us do is it lets us topographically map the outside of essentially their anatomy, and then the computer system will use that to then merge that information and let us see in 3D X-ray vision anywhere we want to go. And so I think that's definitely an advantage for what we do.
That sounds really intriguing. And what I noticed really early on your bio when we started looking at that was just kind of the selfless effort that you're making towards helping others. I noticed that you volunteered when you're up in Jacksonville with SWAT teams, or if there was something serious that came up for that. That gets most anybody's attention when you see that, somebody who, they're not just working on their medical specialty, but they want to contribute to what's going on around them. Can you talk about what that experience was like? Did you have any harrowing experiences?
Yeah, so I started volunteering as a medic back before medical school, and I started working with the Jacksonville Beach team there, helping to initially devise tactical combat casualty care, and helped create the curriculum for the FBI over in Jacksonville and part of that training society. And so initially met a great group of guys there and started working with Tish Galanter, who was part of that team and was the medical director there. And she and I became close friends, and I started training with the team and volunteering to help them and any person that needed it during various encounters. And it was an honor to help those people and help that team there. A great group of guys. That
really is something to behold to. And so what, as far as your career moving forward in South Florida, do you have a really big vision, like the next 5 or 10 years, for what you would like your practice for neurosurgery to become?
Absolutely. So we're really developing new technology in the OR and integrating it here. And so the fantastic thing is all the support we have from the Institute, from the hospital system, and we're getting really the newest cutting edge technology here. And so really growing that and becoming known for using this robotic technology, using the CT navigation, and really doing it all in a minimally invasive fashion where patients can go have a procedure done and then leave just a few hours later. And so really keep continuing to develop that is a goal of mine.
Mm-hmm. Well, just in terms of prevention and treatment then, usually if someone has nasty back pain and it's shooting up a leg or up an arm, they seek your help. Are there any things other than that people might want to be aware of as they're living their daily lives, as they have discomfort? What else might prompt them to want to have an appointment with you and find out what's going on?
Yeah, there are certain more insidious symptoms, I think, that sometimes patients present with, and sometimes we may not even realize what they are until oftentimes it's already caused permanent damage. Sometimes, when there's pressure on the spine and the spinal cord, those symptoms may not manifest themselves as pain or a radiculopathy shooting down the arm. They manifest themselves as diminished manual dexterity. And what that means is people notice that they're not really able to continue using their hands with the same fine movements that they have before, or their handwriting may change, or they've noticed that their walking is slightly a little more unbalanced than it has been. That can indicate, in some cases, that there's pressure in the spinal cord, and even without any type of pain at all, the pressure can continue in advance until these symptoms become irreversible. And so oftentimes, if patients notice these symptoms and they seek out some type of imaging, whether it be an MRI or CT, that's oftentimes the first step to, then going down that pathway and seeing me in clinic.
I see. And so really, x-rays aren't as much of a component of that versus the MRI or CT. Can you speak to that whole decision or that requirement to maybe pursue a more advanced diagnoses?
Yeah, sometimes x-rays can be a good first step, but they really don't help us see the anatomy inside of there. And so if there's any type of instability, if there's any type of underlying deformity, that we can see on x-ray. But if there's a herniated disc or if there's pressure on the spinal cord, we oftentimes need much more detailed imaging like an MRI to see that.
And I understand too, we know from listening to the radio that there are a lot of accident attorneys out there who, want you to come and see them if there's an accident. Are there certain times when someone might be in a car accident, maybe like a week later, where they start having symptoms that would require treatment?
So oftentimes imaging helps us, decide whether or not someone has pain or without any type of underlying instability, or if there's something more concerning. And so if patients have any type of pain afterwards, or if they have any type of weakness or numbness or pain shooting down the arm or the leg, those sometimes can be symptoms that we'll want to seek out more further investigation for.
Well, all this has been really tremendous information tonight, and congratulations on your career so much. And it's always really refreshing to meet somebody who always has people's best interests at heart. And I was particularly impressed by the fact that you would, volunteer up north in Jacksonville and contribute to the SWAT team in that. So we appreciate all your efforts so much. And thank you again. And as we wind up our broadcast tonight, we want to again thank Dr. Timothy O'Connor, available to serve at his practice in Boca Raton. Thank you for watching and listening to our broadcast as we work to make you well aware of our dedicated medical practitioners here in South Florida, like Dr. Timothy O'Connor. Wishing you continued safety, health, and wellness as we move towards Thanksgiving here in South Florida. This concludes our broadcast.
Thanks, Greg.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored